Hi, my name is Jacobi Elliott, and I'm a second-year master's student in the field of health and aging. The research that I'm going to present to you today is part of a larger project, Info Rehab, which has been funded by the CAHR Emerging Teen Grants. The study looks at patients with hip fractures and follows their journey through the healthcare system. Family caregivers are frequently involved in the care of loved ones, so I have chosen to focus on family caregivers during this journey and to look at the contributions that they make to knowledge exchange. The study used an ethnographic approach and took place over the past year in a small rural hospital just outside of London in South Rural. 11 patients and their family caregivers consented to the study and were interviewed and observed at each transition during the rehabilitation stage. Thematic analysis of the data revealed that both knowledge of the healthcare system and involvement of caregivers were of benefit to the patient as well as the healthcare providers. These patients, for the most part, did see smoother transitions. Unfortunately, family members who either didn't trust the current healthcare system or lacked knowledge, which increased their level of caregiver burden, experienced uneasy transitions. As seen in this graphic, unfortunately, the negatives are outweighing the positives. So one family who had a healthy experience said, "Anyone can do what I did. They just have to have a little bit of training. Nobody knows your family better than your family does." This supports many knowledge exchange frameworks, indicating that family caregivers are a good source of knowledge for healthcare providers. Another family who was quite burdened by the experience stated, "It gets costly and time-consuming, which is hard at times. Normally we bowl on Tuesdays, but we've kind of given that up. We would have liked to at least compare what we could have done for her at home." This particular family, who lacked the knowledge of the healthcare system, would have liked to have been presented with other options besides the long-term care option, supporting that facilitations by healthcare providers is needed for family caregivers. Preferably, we would like to see the opposite of this graphic, with the positives weighing heavier. So, in conclusion, an ideal model of care should include contributions that family caregivers bring to the process. As well, support by healthcare providers should be given to caregivers who are unfamiliar with the system. Thank you.